The doctors, the researchers I was working with said, we think patients with POTS, postural orthostatic tachycardia syndrome, are actually perfectly healthy. They're just more aware of their own bodies. What? So horrifying and so shocking, Bria. I thought, we're on our own. I remember one of the doctors saying, Diana, maybe you just need to meditate or something. When I got sick, I was extraordinarily healthy. I ate very cleanly. It wasn't that I needed to change my diet. So it took so much more than lifestyle changes. You're trapped inside this body that's uber sensitive, uber reactive. Every system is affected and no one is helping you out of it.
Question, do you think it's because they thought you were crazy? Hey there, I'm Bria, and welcome to the Period Whisperer podcast. If you're over 35 and ready for real answers about your hormones, you're in the right place. Hit subscribe and stay with us. Hey there, sisters. Welcome back to the Period Whisperer podcast. As you know, Thursdays are our expert interview days, and I am very excited about this conversation. You know, I love to start things with a question. So here's my question for you. What if your dizziness, your palpitations, your anxiety, your gut issues, and even that tired and wired feeling weren't just your hormones? Today, in this interview, I'm joined by Dr. Diana Driscoll, a leading expert on POTS, the autonomic nervous system, and the vagus nerve, which I talk about often, as you know, to unpack what so many women may be missing. We're talking about the surprising overlap between, perimenopause and autonomic dysfunction, why vagus nerve hacks may not be the answer. So I'm really curious about that because I talk about these often, and how symptoms dismissed as stress or aging could really be telling a different story. So if your body has felt confusing lately, and I know many of you have, I think this episode may connect some very important dots, or at least open your eyes to how to even consider yourself in a different way. So please help me welcome the amazing Dr. Diana Driscoll to our show. Welcome, Diana.
Well, thank you, Bria. That was very, very kind of you. It's really an honor to be here. I think as women, sometimes we do have to unite and talk because so many health issues concerning women's health is not getting the attention it deserves. I hope that's changing. But meanwhile, being able to discuss things and get help from each other is essential. So thank you for the work that you do to unite people.
Oh, thank you. And same to you. And I do think women are becoming more aware. I was with some girlfriends last night, and they know more, they're hungry for more of this information. So
Once.
um anyway, I'm very excited to talk to you, but why don't you start a little bit? Can you share a little bit about your journey into even studying the autonomic nervous system and to where you are today?
Yeah. It's not something I would wanna repeat.
Yeah.
But, yeah, I think most of us who are go deeply into women's health have somehow been affected, either in our lives or someone close to us. And indeed, I got sick. I'm an optometrist by education, was perfectly happy being an optometrist, but went on a mission trip, and all of us who went on this mission trip got a virus, but I was the only one who mere 2 weeks after getting this, started to develop some really weird symptoms, and I was thrown into a disorder involving the autonomic nervous system. That's the nervous system you shouldn't have to think about. It's supposed to work automatically, and it wasn't working. And then, oh gosh, a year, 2 years into it, my kids got sick with an unrelated trigger, and we were in clinical trials. My son and I were completely disabled. I had to stop working that very day. It wasn't a subtle condition, but the only thing the doctors were interested in doing was just trying to cover up the symptoms, and it just didn't make any sense to me. So, about 3 years into it or so, the doctors, the researchers I was working with said, "We think patients with POTS, postural orthostatic tachycardia syndrome, are actually perfectly healthy. They're just more aware of their own bodies." What? It so horrifying and so shocking, Bria. I thought, we're on our own. So that's when my journey began in trying to figure it out. I'd established a corporation to house the research. I thought, "Okay, I'm an eye doctor, I'm in medicine, very detail oriented, I have kids affected, I'm affected. Maybe we're set up to get some answers," and started that journey. So I went into it kicking and screaming. It wasn't a totally altruistic journey. I wanted to get well again.
Yeah. That is fascinating, like, that was the response, like, "Oh," and so is that what they told you you had? Is that what you were diagnosed with, POTS?
Ultimately, yes, and what I've come to see is that POTS, where basically a patient gets vertical and their heart starts to race,
Yeah.
there's a reason for that, right? So rather than just try to artificially slow the heart rate down, to me, it's like, well, let's figure out what's causing the heart to react in that way,
Yeah.
right? Because that problem is probably causing other dominoes to fall, which could be why I'm sick from head to toe. They were so focused on the heart because that was the objective marker. But POTS is not a disease, right? You don't catch POTS. POTS is a reaction. It's a presentation. The patient is reacting to something. And in every case, we have to figure out what is it reacting to. And there we can get answers for patients, and full recovery is possible, but not if we're just gonna try to cover up the symptoms. So even the label itself was limiting,
Yeah.
right? Yeah, very, very frustrating journey. Yes, and it was shocking to me too.
I mean, spoiler alert, you do feel well now.
Oh, yes, yes, it has a great ending, I will say. Really good. Kids are fine, I'm fine. They've had POTS care. We're coming up on 11 years now.
Oh, goodness.
So we've been treating this for quite a while. And in every case, it's this medical puzzle that you have to kind of pick apart. Hormones certainly play a huge role in that. But I see so many people struggling with, oh, is it POTS? Is it to the point where the objective criteria, they meet that objective criteria, or are they POTSy, meaning they have a tendency to have an unstable heart rate change when they're vertical? Are they in the same boat? Um, and if so, if we look at that spectrum, how can we help other people whose autonomic nervous system is affected? What are some of the drivers of these changes? And we can help a greater population.
Yeah. So, I mean, you had mentioned before it's like a spectrum, we'll think about it that way. So, just so we fully understand, like,
Mhm.
one, I heard you mention, like, so when we get vertical, when you stand vertical, then you have like kind of a racing heart. What are some of the other things that someone might experience, someone might recognize in themselves that are potsy or pop?
Yes, and this is where it was so hard to see a doctor, and I'd present, like, all of my symptoms, and it was always changing. Every time I went to the doctor, I pulled up a spreadsheet I had of symptoms and had to change it. I thought, "This is like chasing a moving target. No wonder they're frustrated." And then they start to look at you like, maybe you're a hypochondriac. One doctor said, "There is no way every system of the body could be affected by this." I go, "Well, every system is, let me talk you through it." Um, yeah, extraordinarily frustrating, but there are some commonalities, and I think starting with those help. So we look at the tendency to develop a fast heart rate when someone's vertical. Usually the blood pressure goes all over the place. Sometimes it's the same, sometimes it'll swing high, swing low. That's that's a clue to the underlying problems, but it's not a clue to the diagnosis. The GI tracts tends to be affected. So oftentimes we'll see constipation with episodic diarrhea. The gallbladder doesn't work well. Pancreatitis isn't terribly uncommon. Gastroparesis or slow motility is super common. We'll see brain fog, cognitive decline, rather dramatic insomnia, some neck tightness or stiffness, weakness, shakiness, mood. I would say mood fluctuations, but it's like wild swings. There were times I felt like I was, oh, possessed by the devil. I mean, it was clearly not my normal personality. Um, Higher anxiety, swings toward depression, flushing, sensitivities to everything from foods, chemicals, to heat, stress. I know I couldn't even handle a phone call. That was too stressful. I couldn't even think of anything potentially negative, like even the weather, because I would flush and get tachycardia, and so it was just horrible, horrible journey. It feels like you're trapped inside this body that's uber sensitive, uber reactive. Every system is affected, and no one is helping you out of it.
Oh my
Really
god,
bad place
that
to
sounds
be.
horrible.
Yeah, it was. It was horrible. I feel very fortunate that I got sick and dramatically so. Mine wasn't settled. It wasn't like I could just push through. I was dramatically affected, had every psych symptom known to man before my kids got sick. Because if my kids had gotten sick first, Bria, I wonder, would I have thought they're just losing her mind? What the heck's going on? But I've been through it. I knew it was medical. We didn't have all the answers at first, but I knew we'd be barking up the wrong tree by looking at psych diagnoses.
Yeah.
Yeah, which was tempting. Yeah.
For you to have it and then some of your children, it sounds like, is there a genetic component then to it?
Yeah. What a great question. That was my question. When I saw the research and I said, what are the chances that I could be disabled by this? My kids could ultimately be affected. My son was completely disabled. He missed over 3 years of school. And it wasn't settled for him. He got so sick, sometimes he couldn't even sit up without fainting. He developed severe osteoporosis. He broke his arm just trying to put on his coat. Broke his arm throwing a ball once. His growth had stopped. He looked like a skeleton. And again, no one was horrified. I was horrified, right?
Yeah.
No one was jumping up and down saying this is an emergency. I just don't fully understand that. That was extraordinarily frustrating. So, a dramatic presentation, I thought, okay, my husband at the time was fine. It wasn't like there's something in the house poisoning us, which it kind of sort of feels like that. It's not what we're eating. Um, what are the chances there's no genetic component to this? So that's when I set up genetic disease investigators. I thought I'm going to set up a corporation. If I can get answers, great. If I can't, we gave it everything we had, right? But let's house the results in this corporation. And there were genetic components. We weren't the same though. And even my kids and I were different from each other. My son, for example, had an autoimmune condition worsening some of what he had. But we started with the commonalities that went to the differences. And I will say, although it's my goal to be able to ultimately have patients know what their genetic setup is, make it make it objective, have a label based on that objectivity, and then be able to look for things in the blood to tie it all together. That'd be great. We don't have to have that in every case right now to help someone recover. So that is an end goal, absolutely. Yeah, but for now, for patients, they don't have to have all their answers to be able to recover.
So there is a genetic component to it. And is it triggered or like kind of like that, they always talk about we have these genes, but is loaded as the trigger pulled? Like is that trigger pulled pick up a virus? Is it like an immune reaction to some body?
It is an immune reaction. In most cases, we're dealing with some sort of inflammatory event. Many things can trigger inflammation to go up. But if you think of it in terms of genetically, if we're set up where we can't regulate some forms of inflammation well, so if something sets it off, be it a virus, stress, whatever, it almost doesn't matter. Um, and it just runs rampant. It does damage. The damage causes more inflammation. Then patients get caught in this cycle and they can't pull out of it. They don't have the genetic setup so that their body can naturally take care of it. It's not their fault,
Yeah.
right? But we've got to locate, address, and calm things down. And to me, it seems so obvious when I was sick. I said, before getting this virus, I think I was basically fine. I certainly wasn't a sick person. My son got a series of viruses, and these are all viruses that everybody else recovered from. I said, But could that involve an immune system reaction that's abnormal in us? Maybe the trigger isn't what we should be looking for, but we should be looking for the abnormal response and what damage it is doing. And it just fell on deaf ears. I don't understand that. At the time, they had 0 interest in trying to figure it out. So, yeah, I thought if my kids and I have a chance, it's gonna have to be with us. No.
Right, we will. It's super dismissive, like, and this is just like pure curiosity question. Do you think it's because they thought you were crazy, or like they really didn't think there were legs here, or that they were just too whelmed by it and uneducated in it, that that whoever you spoke with was like, "Ah, I'm gonna throw my hands in the air on this one. I can't do anything."
Yeah, I think it was probably everything you just mentioned. Oftentimes, I would be at home and basically ended up bedridden, and when I could cognitively keep it together, I was working on trying to figure things out. And I thought, they are leaving their offices at 5 o'clock or whatever. They're not in it 24/7. They don't have children who are disabled by this. So for me, the motivation for answers was different. The presentation by us and by the vast majority of dramatically infected patients is so confusing. It's incredibly complex. We do ultimately have some psych symptoms. We do appear crazy. So, it's probably all of that, right? But I feel incredibly blessed to have had the medical background. I started looking in the eyes, for example, no one had done that. I had the patience, the detail orientation, the intellectual curiosity, and the personal motivation to get answers, and I think most researchers didn't have that.
Yeah.
I think that most people in research need to be extraordinarily curious, and I couldn't understand why they could see the same patterns in patients that we were going through and still just jump to, "You're just more aware of your own body." What? That's a huge leap off of a cliff, right? Why won't they just stick with it? Um, but yeah, they went home at the end of the day, and I couldn't escape it.
Yes.
Boundaries and
I wanna kinda talk, move into sort of the hormone aspect because I think that's super relevant, but I have to ask, so when
yeah,
you actually considered, like, looking in the eyes, being that you were an optometrist trained, what
yeah,
learn? What did you learn about
yeah.
eyes and autonomic nervous system and POTS?
Yes, it was a good place to start. It wasn't where we ended, but it's certainly a good place to start. And everything that we found, or most everything, is in the book, The Driscoll Theory. I put that out. Gosh, it's been 15 years. And I'm happy to give that to anybody who wants it. Just holler at me. Because it did change everything. Uh, in the Driscoll theory, the first thing I released was that there was a propensity to develop high intracranial pressure. And what I saw in the back of the eye, we did a study where I brought in 35 patients affected with POTS and 35 age matched normals, and we did everything we could think of ocularly, including pictures of the back of the eye. And in the back of the eye, it's the only place in the body you can look directly at blood vessels and you can look at the optic nerve. The optic nerve, the appearance of it can be affected by high intracranial pressure. I was able to figure out who was a patient and who wasn't just by looking at these images
Oh my goodness.
90% of the time.
Oh my goodness, that's fascinating.
So, I knew there were clues, right? But the clues I was seeing and the patterns I was noticing was not something that as an optometrist I would have flagged in my practice going, "Well, this isn't right." I could only see the pattern when I saw a lot of patients. One was the optic nerve margins weren't perfectly clear. And as eye doctors or as doctors, we look at the margins and only flag it if the margins are blurred all the way around, there's protrusion of the optic nerve. It wasn't to that point,
Oh,
but it wasn't quite right either.
yeah, it was off.
Yeah, and then the blood vessels, again, not enough to, sound an alarm, but the veins were either too large, the arteries were too small, the ratio between them was off, or the veins were not smooth in caliber. veins are usually very smooth, and there was a dramatic propensity for very early and abnormal plaque formation in those arteries. Even in like my son, who's 9 years old, why would he have premature plaque formation in his arteries? But we started to look at what could be affecting the vasculature of the body systemically. I don't think it's eye problem per se, but this was just a window into systemic illness, and it gave us some clues of where to go from there. Yeah.
Wow, that's super fascinating. Thank you for sharing that. I find it so amazing to well, to I mean, I wouldn't ever have a window into that without talking to you, so that's very
Right.
interesting.
And that no one thought to look in the eyes before in patients. Why not?
Yeah.
You know, I don't know, but it was my comfort zone, right, Maria? So I thought, well, let's start there. Let's just see.
What I
I
know.
remember thinking there's no way you can be this sick without something showing up somewhere. You know,
For sure, there's
would
gotta
say, well, your blood work looks good. Everything looks fine. I go, it is not fine. Whatever is wrong, you're not looking in the right place. I don't know where to look, but let's start with the eyes and see. And we just went from there. Um,
so something triggers the autonomic nervous system, maybe as we said, stress and anxiety from outside of the body, maybe stress and anxiety inside the body with a virus or an exposure to something. We don't could be either of those things. And we sure have a lot of these symptoms, ironically sounding like very similar symptoms that we have in perimenopause. I
Absolutely.
think.
And I
And
really look forward to talking about that.
yeah, I was shared with you before we got on the call that I had went through a whole series of doctor's visits with my daughter because they were concerned that she had POTS and around that puberty time, right? So we're talking about this big hormonal shift. Oh, and we're talking to women going through a big hormonal shift. So I'd
Yes.
love to talk a little bit about that overlap between these hormonal shifts and POT symptoms, like palpitations, dizziness, fatigue, temperature regulation, all the things that I think you have talked about already today. Like, what
Yeah.
you see happening in these times, or what is the impact there?
Yes, and it's tremendous. I remember talking to a friend and, um, not in the health field, right? And I said, "Yes, at Potts Care, we see probably 90% women." And he said, "Oh, that proves women are the weaker sex." Said, "No, it doesn't prove that, but it proves there's likely a hormonal component to this," kinda setting us up for some of this, but I think what we need to do, and we certainly do with our patients, is step back in every case and remove some of these labels. POTS is a horrible label, and it implies that it's a heart problem. It's not a heart problem. The heart is reacting to something, and the criteria for diagnosing POTS is totally arbitrary.
Oh,
Someone picked out of the sky, well, if we put someone in a tilt table and their heart rate increases, let's say 30 beats a minute,
mm,
they'll have POTS. And I said, okay. So clearly, if the heart rate increases only 29 beats a minute, they don't have POTS. They have something different. And the doctor's like, well, no, that's probably still POTS. I went, oh, okay. Any 28 beats? You know, so the idea is, why are we picking this arbitrary criteria? And instead, shouldn't we be looking at patterns of illness? And one of the patterns is a tendency to develop fast heart rate upon standing, dizziness, etc., GI tract being affected, all those other symptoms. If a patient is starting to fit some of these patterns, we know eventually they will get to that point where the heart rate goes up that dramatically. We don't need to wait for that,
yeah.
right? And then how many patients are dealing with something on a lower level where they still fit a pattern? They're not disabled, like I was disabled, but the autonomic nervous system is affected by inflammation, and they are not as healthy as they could be. Hormones exacerbate some of the types of inflammation that can cause. And it's not the hormones themselves, it's the swing in hormone levels. So it's likely why women are much more prone to ultimately being diagnosed with POTS. And then the changes to the cardiovascular system, the autonomic nervous system, the immune system, etc. we have to look at how these hormone swings are affecting that. And then can we be healthier throughout our lives, knowing what we've learned about that? How can we be proactive so that one, we're not sick, and two, we're healthier even than our peers as we go through life? And that's uber important to me now because I was sick for, gosh, a decade, and now at my age, I don't want to ever go backwards. I don't want to have that typical old age illnesses, feeling tired or, brain foggy or whatever. I don't ever wanna go there.
Yeah.
So I'm extraordinarily proactive, and in my health, I think we all should be.
Yeah.
Yeah. So
Did you change, like, now that you have been through this and you're, healthy, if we look at kind of your before and then your af not that's the pain in between, what are some of the lifestyle habits that you really, appreciate now for yourself to stabilize your health?
yes, and I think it's so important to know that, and not atypical. I think when I got sick, I was extraordinarily healthy. Like, I remember the doctors at Mayo saying, "Well, you need to exercise and eat clean," and I said, "Excuse me." When I taught exercise, I think my resting heart rate before I got sick was 45. I was a runner. I taught aerobics classes. And when he was doing the physical exam, he said, "Diana, your calves." And I go, "Would you mind making a note on the record that I'm not deconditioned?" So if I was deconditioned, I would understand why the advice of you need to exercise to get healthy would make sense, right? But I'm going into this,
Conditioned.
I'm yeah, very conditioned, right? So that wasn't the cause. And they said, "Well, let's talk about your diet." I was like, "Let's talk about that." Nutrition was kind of a hobby of mine, you know. I ate very cleanly. I felt better when I did. Um, it wasn't that I needed to change my diet. I was not at home eating donuts, or whatever. That wasn't my life. So it took so much more than lifestyle changes. I remember one of the doctors saying, "Diana, maybe you just need to meditate or something." And so I know how it looks to you on the outside, where my heart is racing. I feel like I've been flooded with adrenaline. I'm shaking all the time. My resting heart rate was 123. I remember the cardiologist. That was my calmest resting heart rate. And I said, "And I will meditate. I will do that teaspoon of help against this tsunami, this ocean just hit me. You figure out what that ocean is. I'll do my part with the teaspoon. But there is no way this dramatic illness is under my control. I can't do it." And I wasn't, 13 or something. I was almost 50 years old. I had a successful life. I had 5 businesses, It wasn't like I just couldn't handle this. This was a medical change, so it took so much more than lifestyle. Part of my lifestyle now is making sure that I keep on top of inflammatory conditions. I'm hugely proactive with vasculature, the blood vessels, right? And seeing the changes in the eyes, even in my son and I, it was kinda horrifying, honestly. So that unless we're very proactive with this, I could see it going into vascular dementia, some sort of neurodegenerative condition, in which indeed we did see some of that. So being proactive on some of those setups that weren't our fault,
Yeah.
and then sure, absolutely, exercise, eating right, meditating, whatever. Absolutely do that. I think that's great. But we do not want to blame the patients for their illness. This was not our fault, right? It was medical. And now we're very proactive to maintain health.
So that's fascinating. I really love that example you gave of like, I will do my teaspoon meditation to fight this tsunami, and in some situations, teaspoons add up. I think we can all agree to that. But
Yes.
when what did move the needle for you? Like, what did quiet this tsunami? How did you get out of this spot?
Yeah, it was a long haul, I'll tell you, because there wasn't like one answer. Um, there were some higher level drivers where other things fell, but I was able to figure out what fell, like, one thing at a time. So it was quite the journey. And again, the Driscoll theory lays out quite a bit of this, but the first thing I discovered was our intracranial pressure's high. Did not see that coming. And when that was released, it went around the world, which was awesome. No one had ever considered the role of intracranial pressure in some of these chronic inflammatory problems. It didn't present as typical. So doctors missed it every time, but I had pretty much every symptom of it. The MRI was suggesting that tendency. My kids kind of followed suit. So there's medicine to bring down intracranial pressure. I
Okay.
got on medicine. I thought, okay, well, that was life changing, you know.
And what
Um,
they finally understood that you have this intracranial pressure and that this is a part of this status that's happening and took some medication and that did.
yep, absolutely. And again, this is where being an eye doctor was a godsend because we are used to treating that, identifying and treating it. We didn't present as typical. In other words, the optic nerve wasn't swollen the way we would look.
Yeah.
I didn't want a lumbar puncture to confirm this because of the potential dangers and potential chronic problems with the lumbar puncture. But I knew as an eye doctor, we can just treat it. And until I had the answers I needed, I was also very fortunate the medicine was in my office because eye doctors use this medicine all the time.
Yeah.
So that ended up working out very well for us. But high intracranial pressure, which drove a lot of the dizziness, the brain fog, even the POTS itself, neck stiffness, dramatic insomnia, is a secondary problem. There's some inflammatory process driving that,
Yeah.
right? So you don't have the answers. But the next layer of answers came when I was suspecting the vagus nerve wasn't working well. And I had some objective evidence because my gallbladder wasn't working. They tested it and said, well, we need to take this out. I went, "Oh, is it, like, infected? Is it, like, an inflamed, like, an appendix that's gonna blow or something?" And he said, "No, looks fine." I went, "Oh,
It's just not doing its job is what they
it's
were.
not ejecting enzymes, right?" I said, "Oh, is the opening maybe stuck?" And they said, "Nope, you can see it's open." I went, "Okay, well, it sounds neurological to me.
Yeah.
It sounds like the organ's just sitting there waiting, let me know when you need me. And if it could get the proper signal, maybe I could save this organ." So I didn't want to remove it. And to me, it just didn't make sense to remove a otherwise healthy organ. It just made no sense at all.
That it might just not be getting the communication because that's not the problem, as you're saying.
Right.
Oh my god.
So I dug into, if that was the case, why was this happening? What could I do to correct that? And is it really a vagus nerve problem? Or is that just one presentation of a bigger problem? Is it a problem with the neurotransmitter? And that was the next big aha moment that we had was I sent out symptom checklists for chronic fatigue syndrome, POTS, fibromyalgia,
Yep.
PTSD. And in these, like, 200 symptoms, I put 38 or 35 symptoms of anticholinergic syndrome, meaning a syndrome, a presentation that occurs when the neurotransmitter needed by the system of the body is not working well, and saw the pattern was dramatic,
Oh my.
that patients weren't necessarily suffering with a vagus nerve problem, it was a neurotransmitter problem, and then figured out a way to test the receptors of the neurotransmitter. Those worked great, and then used that information to come up with a supplement blend that could trigger the receptors. We could get the GI tract working well, the gallbladder, working well. And the only objective marker I had, well, I guess there were two. One was having a bowel movement. That was subjective. And then two, we wanted to see the pupils of the eyes get just a little bit smaller. In other words, have those normalize because that's affected by the neurotransmitter, but it is not affected by the vagus nerve. And I suspected this was a bigger problem than the vagus nerve. If we stayed at the vagus nerve, we wouldn't get there. And indeed, that's what it was. So the inflammation was blocking that neurotransmitter. And ultimately, and I'm proud to say I have 5 patents on this. No one had ever put this together before. So Parasin Plus is a supplement I put out, via those patents to restore that neurology. It worked beautifully. Yeah. So that was another layer
That's
to it.
amazing because so it was hearing that your
Mhm.
gallbladder was not doing anything, but not that
Yes.
when it's like as you said, it's like when you started to be curious and ask questions, and I think this is really important for the women listening, like, it is quick that people say, "Oh, we'll just remove that," whether it's your uterus, whether it's your gallbladder, or whether, something that you can survive without, but it's a big deal to have an organ removed from your body, and it impacts the rest of your body. So that's some really powerful questions I think you just shared in your curiosity to your practitioner around, well, is it not doing its job or it just doesn't have a job to do in a way? Like it just isn't being told. So that's where that link between the vagus nerve, is it
Mhm.
kind of deep more into this autonomic nervous system stuff or a neurological issue?
Yes, and if it's a neurological issue, what's causing it?
Yeah, what's causing
Right?
it?
So, ultimately figured out that some elements of inflammation will block the release of this neurotransmitter, and not just at the vagus nerve, but throughout the sympathetic or parasympathetic nervous system and at the brain level. So, it's the central nervous system, the peripheral nervous system, and the autonomic that's affected. It's a bigger problem than just a vagus nerve problem. And it's being driven by the inflammation. And how ironic, because the vagus nerve, which is ultimately affected, is the anti-inflammatory nerve of the body.
Yeah.
So the inflammation was actually keeping that from working well. And again, getting caught into that cycle of the inflammation would just get out of control and it would just cycle up higher, worse and worse. And we didn't have that nerve to help us maintain it. So yeah, that was kind of crazy. But I remember at the end of this thinking, I think this is new. I think this might be patentable that no one's ever really sat down and worked through this carefully. And indeed, I remember the patent attorney saying, "Oh, this is amazing." And we could prove it, right, objectively. So that was huge. And then ultimately getting to how else is this inflammation affecting us? How can we get our cardiovascular system to calm down, restore vascular health, and maintain it the best way possible?
Are there specific inflammatory markers, or are you able to isolate which inflammatory markers are the ones that are triggering this type of
Yeah.
or issue?
Yeah. Sometimes, again, everybody's so complex, but there's a page on our website called Inflammatory Pots. I put out that term many years ago. And long before COVID, and I remember I got so much pushback on that, which isn't atypical, saying, "Oh, there's no such thing." It's, "Oh, you just like, you'll see, you'll see." And COVID kind of pushed that point. Ultimately, I think in most post-COVID patients, the majority of doctors recognize there's an inflammatory component. So the term inflammatory POTS kind of caught on finally, which is great. But in that page, I go through quite a few inflammatory conditions, tend to be chronic, tend to wax and wane, that can drive some of the changes to the cardiovascular system. And I think that's a decent place to start. And some of those do have blood markers, which can be a great place to start. Yeah. But we know not all inflammation affects the cardiovascular system. So if a patient does show POTS or heart rate changes dramatically when they're vertical, at least it limits to some degree. We don't have to look at every inflammatory condition known to man, which is awesome. It limits the playing field to some degree. Yeah, it's still complex, I will say. Um, but yeah, there's inflammation going on somewhere.
Mm,
Yeah. And importantly, the traditional markers that we consider as doctors to look at inflammation, that would be CRP and sed rate, generally normal. So
mhm.
another study we did was I was suspecting inflammation at the time before that term inflammatory plots, but I didn't know. So we were fairly new at measuring inflammatory cytokines, and we did a panel, which was as complete as we could get at that time, of inflammatory chemokines and cytokines in patients. And some of them, Bria, were like 10,000 times what's normal, which just seemed crazy to me. We had the lab retest, just to make sure, but the traditional markers for inflammation were normal. And I thought, as long as we're looking at these traditional markers, we are missing these chronic patients, right? They're not really invisible. We're just not able to measure this properly. So that was a huge breakthrough too. Yes.
So then you look to other markers that aren't traditionally run.
Yes, we had to.
Yeah. Yeah.
Yes, absolutely. And again, we can sometimes just be guided by symptoms. Like, again, if it's affecting the cardiovascular system, that it guides. Patients get sensitive. They're more prone to things that could look like a hormone swing. But ironically, hormone swings exacerbate the inflammation, the inner lining, the endothelium, the blood vessels, the nitric oxide production. They do affect acetylcholine, that neurotransmitter. So there's definitely overlap. It's like that the diagram, the circle.
Venn diagram. Yeah.
Yeah, thank you. Where the Venn diagram shows, okay, it's hormone fluctuation. This one is it's cardiovascular response to inflammation. There's definitely overlap. There is effect by the hormones. So it does complicate the picture. Absolutely, it complicates it. It doesn't mean there's no way to treat it, but it does make it more complex.
You had mentioned that we see POTS more in women than men. Is that getting that right? And is there an age bracket you see it more commonly in?
Yes, and I look at that and wonder, is it because there's more awareness at that
Mhm.
point? I don't know, but it does tend to affect females in, early 20s, let's just say. Having said that, my son was 8 years old, and he was a male, and he got sick.
Yeah.
Uh,
And you
I was almost 50.
yeah.
Right, and we see it all. I have seen it all from 3 years old to 90, you know? So do know that. But we did go through our records and went, "Okay, what percent of women is it?" It was pretty high, probably close to 90%. So,
Okay.
yeah, I'm sure there's some awareness, but I did have to look into, what are these hormones doing? Why is it patients who are affected have a dramatic downturn prior to their cycle time, and looked at the swing of hormones that will trigger a cycle. What can we do about that? And I remember at the time talking to my neurologist, holding up a calendar, a month calendar. I said, "Okay, here's my period. I could guarantee these 10 days, okay, around it, I have no functionality whatsoever." I said, "The other days are a roll of the dice, but those."
The hormones dropped, things were worse, and then when they cut that, then it was maybe okay, maybe not.
Yep. Exactly, dramatically. So we at the time.
Hormones is a bit of a buffer for us, right? They're a bit of a buffer with our adrenals, with our adrenal hormones, which is gonna be impacted, and impacting our nervous system, so, I guess it's like that buffer goes away and suddenly you're unprotected.
Yes, it's interesting to see because, like estrogen, for example, is somewhat anti-inflammatory, but when it swings way up or way down, especially down, it's an inflammatory event. So if someone is already set up where they have systemic inflammation, that is too much for their cardiovascular system to handle well.
Right.
And the blood vessels were, again, dramatically affected. The veins would dilate, blood would pool. Patients who experienced this, the vessels would dilate abnormally where they felt hot,
Oh, yeah.
heat flash, heart would race, incredible anxiety. And it wasn't a psychological event. It felt like the body was self-destructing.
Yeah.
I mean, I went to the emergency room a couple of times with these episodes, and I understood, to the uninformed, it looked like I was having a hot flash. I mean, it was so much worse than that. My body was self-destructing is the way it felt. And then to see this happen in my children, this wasn't perimenopause, my 8-year-old son. This was, yeah, an inflammatory event that can be worsened by those changes in hormones. Yeah.
This has been fascinating. I really could probably spend like, I just find it so interesting, and I think it's incredible how, you were able to start to connect these dots to even recognize that neurotransmitter aspect, uh, the cranial pressure, like, it's unbelievable, like, to help people no longer suffer, and I do love that, I think all practitioners do such a good job of being like, no matter what, we need to have these health foundations. Like, you still have to be focused on an anti inflammatory living, but it can still happen in spite of those things.
Yes, thank you for that. Yes, it was terrible to go through the illness. My heart goes to anyone dealing with some sort of invisible chronic illness. It can just be incredibly miserable. But it was just as miserable not to have any validation
Oh,
for that suffering, right? To see my son, I felt like he was dying and had no one by our side to help. I hope we look back on this in 10 years maybe, and I want to hear the medical professionals, we really messed up on these patients. Okay. We kept them sick. We made them sicker. We accused them of causing their own illnesses. And actually, they were suffering horribly.
For anyone listening who is experiencing some of this, I think they will know that very quickly, or maybe they have a child because, as we said, it spans all ages. How Where do they best learn more about your work? I know you talked about your book. You talked about some things on your website. Let's share where they can learn more from you on
And
it's I think it's going to hit home for those people who understand it or might not yet.
yes, I would love to share that. This caused so much angst for me over the years because I knew what I was figuring out was important. We needed to share it with as many people as possible, but it was so complex. So I ultimately set up a Patreon account called Pots Rebels, and that's where I put everything. So, and we meet like every couple of weeks to answer questions and help patients through this. What is happening with POTS should not be happening. Okay, what happened to me and my kids should have never happened. We should have never gone through that. But still in the position where until things are greatly understood by the medical community, it's actually in medical schools, it's in the literature, it changes the evaluation and treatment paradigm. We're kind of still on our own. So I just had to release this information. So it's on POTS Rebels, the Patreon account. And, we continue to release information. There is more coming. I'm really excited about doing that, again, with the ultimate goal of getting down to the genetics of it.
Thank you
Yeah.
so much. I have your other websites and
Thank
everything. We have our own
you.
show notes here, and I encourage anyone listening, this for me, this was so fascinating. It's another reminder that our body is all connected. That it's
Yeah.
not just one thing, right?
Amazing how that can happen. I would
Fascinating how that happens. It's not just the knee bone connected to the leg bone, It's like much
Yeah,
that.
and it is so easy, as you said, to think of one thing, like, is it cortisol? Is it hormones? Is it a bigger picture than that? And you don't have to be as sick as I was to be suffering from some of these things that we can absolutely stay on top of, right, if we have the tools, and the tools didn't exist at the time I went through this, so we can be more proactive. And I suspect a great number of people who are really struggling with things like perimenopause, hormone swings, maybe even early, puberty, are actually struggling with a chronic inflammatory condition that has not been diagnosed, making them much more sensitive to those swings. And if we identify and treat that systemic inflammation, they can handle those hormone swings much like other people, right? It isn't like they're delicate or just sensitive or,
Something else
you know,
going on.
hypochondriac. Something else is going on, right? That's causing that.
Dr. Diana Driscoll, thank you so much for your time, for your beautiful knowledge, for all of the effort you have gone in. I know it's making a difference in many people's lives, and we just appreciate having you here so much. Thank you.
You so much appreciate you.
Yeah. And sisters who are listening, I feel like we gave you an amazing amount of information here today. But most importantly, I hope you recognize you're not alone, recognize there's other answers out there for you, and to keep kind of looking under the hood and being more in your life and not just less on a scale. We'll catch you in the next episode.
If you're 35 plus and ready to stop guessing, start understanding your hormones, and feel your absolute best, hit subscribe. That's what we do here.